Great.
Thank you, Mr. Chairman, and Chairman Markozik and Chairman Adolph, thank you very much for the opportunity, other members of the committee, to be here. Bill, this brings back a lot of memories being here on the Appropriations Committee. I served on the committee for 10 years and sat in on the hearings. I really know how important this is, the job that you're doing here. So thank you for the opportunity. Mr. Secretary, good to be with you today. Welcome, as the chairman said, welcome to Pennsylvania.
Thank you.
I want to focus my comments and questions today on Act 50 of 2010, which creates the new Department of Drug and Alcohol Programs and was signed into law last year by Governor Rendell. And I know you're new, and so I thought I might just give you a little bit of the history of the new law, Act 50. It's something that I've been working on probably for about 6 or 7 years. We actually got a vote in the House of Representatives back in 2005, 2006. The bill passed out of the House almost unanimously. I think there were a couple negative votes. Did not get a vote in the Senate. We actually got a vote the following session in 2007, 2008, and the same thing happened. We passed out of the House of Representatives almost unanimously. I think there were 2 or 3 negative votes, and it sat over to the Senate and did not get a vote. And then last session, we actually did get a vote in the House. Again, passed almost unanimously over to the Senate, and there were a couple negative votes over in the Senate. It picked up an amendment, came back to the House. Again, we voted on it, and Governor Rendell signed it into law last fall. The new department is supposed to take effect July 1st of this year, and just, very simply, it elevates the Bureau of Drug and Alcohol Programs in the Department of Health, the cabinet level status. Senator Pat Brown in the Senate had the exact same bills the same time that I did. It was just my bill that moved a little bit quicker. As I look at the members of the committee and in the room, I believe, and I think I'm correct in saying this, that every member of this committee voted yes for this bill. There is an enormous amount of enthusiasm and excitement around the state. Everybody that works in recovery, that works in prevention, our county administrators are signed off on the bill. Everybody is excited about this new department. And then, after the budget address, I pick up the budget document, and in your budget book, on page 22.20, I read it. I'll tell you, I was extremely, extremely disappointed and really surprised. I read, this budget proposes to maintain the program within the Department of Health in an effort to preserve the state's limited resources for treatment services as opposed to new administrative costs. And again, I was really shocked. I really was. I know our new governor. I respect him very much. Quite frankly, I really admire him. When he was Attorney General, I worked with him numerous times on issues that pertained to drug and alcohol treatment, prevention, addiction. As a matter of fact, the Attorney General Corbett, he was the counsel when they tried to overturn our insurance law, Pennsylvania Act 106. He was the counsel, the Attorney General's office, that defended the act, and it went all the way up to the Supreme Court, where we finally won. I know he believes in treatment. I know how much, how hard he works, that he believes in treatment and how it's a good thing. And that's why, quite frankly, I was a little taken back by this. Now, I'm not the smartest guy in the world, and as a matter of fact, my grandfather, God rest his soul, when he was alive, used to say that I was born stupid and been losing ground ever since. But, I work hard, and I got a little bit of common sense, and this just makes so much sense to me to do this. We need leadership. This is a disease that is affecting 1 in 4 families who live in this state of Pennsylvania. And I want to point to an article. I mean, I think all of us might have got this from the Harrisburg Patriot News. It was an article. It was about a 7 or 8 page article. Pennsylvania's broken prison system and how to fix it. Hard time for taxpayers. And you know, it was a really good article on what fuels the prison system. And I've always thought, and I think it's true, that 3 out of 4 of the people that are incarcerated right now in Pennsylvania are there because of a drug or alcohol addiction. And in one section of the article, it points out that a couple of the states are really looking into this and pushing treatment instead of incarcerating people. And one state, I won't mention the name, spent $250 million additional on treatment and saved nearly $2 billion because they put people into treatment, nonviolent offenders, instead of put them in the prison. Another state are closing prisons and now housing some of Pennsylvania's inmates. To me, Mr. Secretary, I mean, this is just so much common sense. This is about reducing crime. This is about reducing our prison population. This is about, more importantly, saving lives. Now, when I look at your budget document and you talk about, you know, the administrative costs of implementing this program, they are minimal. They are minimal, Mr. Secretary. I mean, I've actually had meetings with member of the legislative staff of the administration and basically showed them how this could work and how we could do this for a minimal cost, if not next to anything. So, you know, putting in here, you know, limited resources for treatment as opposed to administrative costs, to me, doesn't make any sense. And there are also other ways that we can pay for the administrative costs. It's minimal. I believe the fiscal note at one time on this was around $800,000 to implement this. So, I mean, I think it's a minimal cost and it would do a lot of good. To me, again, 1 in 4 families are affected by this. This is innovative. I mean, it has support all across the state of Pennsylvania. It has support and it is the will of the legislature. It is now in law. I mean, to me, this makes sense. You know, I really hope we don't miss this opportunity, this innovative opportunity. I mean, I think we can be a model for the rest of the states. And again, this is about saving money, reducing crime, reducing our prison population, and saving lives. So, and again, I don't want to put you on the spot. I know you're new at it, you're new here, you're trying to balance 100 different things. But, you know, I'd really like to hear, you know, your comments and, you know, moving forward, I really hope that the administration would take another look at doing this because I really think it's important. It has the support of the legislatures. It has the support of everybody across the state. Minimal cost to implement this. To me, it's just common sense that we do this, and I would appreciate your comments.
Thank you for giving me the opportunity to comment on this. First of all, I'd like to say I admire your passion and your insight in this horrific public health issue that does devastate families and entire societies. First of all, as a law-abiding citizen, I understand it's the law. As a member of the bar, because I am an attorney of New York, I understand and have I think a deeper understanding and respect for the law. I understand it is the law. And as some background, as a former corrections surgeon, I was very much involved with drug and alcohol treatment programs, not only in New York when I ran an experimental punitive segregation unit, but also when I worked in Connecticut, and I saw the results of drug and alcohol situations just being left, just basically to go wild without societal intervention. I also prescribe medications to help create the protocols for treatments, for example, in incarcerated men and women regarding this type of treatment, and made evaluations. So I've had firsthand experience as a physician, also dealing with friends that have had these types of problems and seeing the tragedies that can occur. And it's just not one individual that's affected, it's the entire family. I would go as far as saying it's society in general. We all hurt. I'm aware of that. I'm aware of the program. In the 66 days that I've been here, I've had time to review, and as I said, I applaud your efforts and the energy and the time that you've put into this. I'm waiting for direction. What I've been told is that it would be, in this fiscal situation that we find ourselves in, that simply it's not an affordable option. This is what I've been told. I'm waiting for direction. I'm open to direction. As it stands now, we've put to contingency plans for this to take into effect July 1st. In other words, the department has put in place for that transfer to occur. We will continue providing services as it has happened in the past, and I think that the services that have been provided have been more than adequate, have been outstanding, until I'm told to do otherwise. But the contingency plans are there, and I'm waiting for direction, and I'm more than happy to enter discussions with you, and I'm waiting to hear from the administration regarding that. As it stands now, though, what I've been told is that that there are no funds for this department. I'm sort of in the middle of this, but I can assure you I would never default or not give the appropriate attention to this vulnerable population, which sometimes society just casts to the side. And I would never do that and never allow that to occur. So you can rest knowing at this point it's being taken care of, and we're ready for the transition should that occur.
Okay. Just a quick follow-up, Mr. Secretary, Mr. Chairman. I appreciate your willingness to have a discussion about this moving forward. The Bureau of Drug and Alcohol Program has been doing a really good job. I do not want to say anything other than that. But I think leadership, when you talk about a new department and a new secretary, we get the right person in that job with the leadership abilities. I think it's going to be revolutionary when it comes to the way that we look at addiction and our prison population here in Pennsylvania, and I would hope to have those discussions moving forward because I think it's the right thing to do. And again, as far as the cost of implementing this program, it is minimal, and I can show you some other ways. I would really like the opportunity to talk to some people and show them other ways that we have to pay for the administrative cost of implementing this new program. And again, there's an awful lot of excitement. And you were in my office a short time ago. We had a discussion on a different issue about the abortion clinic in my district, and you saw the box of pictures on my couch of the dead children who died because of overdoses around the state of Pennsylvania. And every one of those families, every one of them, the common thread was the families were desperately trying to get them help and get them into treatment. Unfortunately, it did not work for them. So I appreciate the opportunity to be here, Mr. Chairman, and moving forward, would love to have the discussions with you.